If you have diabetes, you've probably asked yourself this question more than once. Can I even eat fruit anymore? You've been told fruit contains sugar. You've been warned about glucose spikes. Maybe someone even told you to cut fruit out completely. But here's the truth. Not all fruits affect blood sugar the same way. Some fruits can actually support better glucose control when eaten correctly. Others, however, can send your blood sugar soaring faster than a soda. The problem isn't fruit itself. The problem is understanding which fruits work with your metabolism and which ones work against it. In today's video, we're going to break it down clearly and responsibly. You will learn the 10 best fruits for people with diabetes, why certain fruits cause smaller glucose spikes, the 5 fruits that can be problematic if you have insulin resistance, how portion size completely changes the metabolic effect, and how to combine fruits strategically to reduce blood sugar impact. Because here's something most people don't understand. Fruit contains natural sugar, yes, but it also contains fiber, antioxidants, polyphenols, water, and micronutrients that influence how that sugar is absorbed. Some fruits have a low glycemic index, some have high fiber density, some contain compounds that may even improve insulin sensitivity. Others, they are extremely concentrated sources of fructose and glucose with very little fiber to slow absorption. So instead of fear, today we're going to focus on clarity. If you have type 2 diabetes, prediabetes, or insulin resistance, this video may completely change how you look at fruit. Stay with me until the end, because the final 5 fruits on this list are the ones most people assume are healthy, but can quietly sabotage blood sugar control. Let's begin. Let's start with 2 of the safest and most metabolically friendly fruits for people with diabetes: berries. Strawberries, blueberries, raspberries, blackberries. Berries are often considered one of the best fruit choices for blood sugar control, and for good reason. They are naturally lower in sugar compared to many other fruits, but what really makes them powerful is their fiber and antioxidant content. Fiber slows down glucose absorption in the intestines. That means instead of a rapid spike in blood sugar, you get a more gradual rise. But there's something even more interesting. Berries are rich in polyphenols, plant compounds that have been studied for their potential role in improving insulin sensitivity and reducing oxidative stress. In simple terms, they don't just contain sugar, they contain protective compounds that influence how your body handles that sugar. A moderate portion, about 1 cup, typically produces a much smaller glycemic response compared to tropical fruits. And when combined with protein like Greek yogurt or healthy fats like nuts, the blood sugar impact becomes even more controlled. 2. Apples. Now let's talk about apples. Many people avoid apples because they taste sweet, but sweetness alone does not determine blood sugar impact. Apples contain soluble fiber, particularly pectin, which helps slow digestion and glucose absorption. This means the sugar in an apple enters the bloodstream more gradually compared to fruit juices or dried fruit. Another key factor is structure. When you eat a whole apple, you chew it. The fiber matrix remains intact, the digestive process takes longer. But if you drink apple juice, the fiber is gone, the sugar hits your bloodstream quickly. That's a completely different metabolic effect. Portion control still matters. A medium apple is generally a reasonable serving for most people with diabetes, and pairing it with protein like a handful of almonds can significantly reduce post-meal glucose spikes. Already you can see something important. It's not about banning fruit, it's about choosing wisely and eating strategically. Let's continue with 2 more fruits that can fit safely into a diabetes-friendly plan when consumed properly. Pears. Pears are often overlooked, but metabolically they are very similar to apples and sometimes even better tolerated. They are rich in soluble fiber, particularly in the skin. That fiber slows the absorption of glucose and helps reduce sharp post-meal spikes. A medium pear contains a meaningful amount of fiber relative to its sugar content, which makes it more balanced compared to many tropical fruits. Another advantage: texture. Like apples, pears require chewing and digestion time. That mechanical process alone slows down how quickly glucose enters the bloodstream. But here's the key: eat them whole. Not canned in syrup, not as pear juice, not dried. Dried pears remove water and concentrate the sugar, dramatically increasing glycemic load in a very small serving. A whole fresh pear paired with protein or healthy fat is far more metabolically stable. 4. Cherry. Cherries are interesting because although they taste sweet, they have a relatively low glycemic index. They also contain anthocyanins, natural pigments that give them their deep red color. These compounds have been studied for their potential anti-inflammatory effects and possible support in glucose metabolism. While cherries do contain natural sugar, the combination of fiber and bioactive compounds appears to blunt the glycemic response compared to fruits with similar sweetness levels. Portion control still matters. A small bowl, roughly 1 cup, is typically reasonable. But there's something critical to understand. Sweetness perception does not always equal glycemic impact. Some fruits taste extremely sweet but have moderate blood sugar effects because of fiber and plant compounds. Others taste mildly sweet but cause rapid spikes due to low fiber density. Understanding this difference changes everything. So far you've seen a pattern: whole fruit, moderate portion, paired strategically. That formula is what makes fruit work for you instead of against you. Now let's move into 2 fruits that often generate confusion but can absolutely be part of a smart diabetes strategy. 5. Kiwi. Kiwi is one of the most underrated fruits for blood sugar management. Despite its sweet tart flavor, kiwi has a relatively moderate glycemic index and contains a strong combination of fiber and vitamin C. But here's what makes kiwi metabolically interesting. It contains soluble fiber that forms a gel-like consistency in the digestive tract. This slows carbohydrate absorption and helps reduce post-meal glucose spikes. Studies have shown that when kiwi is eaten before or alongside carbohydrate-rich meals, it may blunt the overall glycemic response. Another advantage? Portion control is naturally built in. Most people eat 1 or 2 kiwis at a time, not 5 or 6. And compared to many tropical fruits, kiwi has a lower total sugar load per serving. The key is to eat it whole, not juiced. Juicing removes fiber and changes the metabolic effect dramatically. 6. Oranges. Whole, not juice. Now let's talk about oranges, but with an important distinction. Whole oranges can fit into a diabetic-friendly plan. Orange juice cannot. When you eat a whole orange, you consume fiber, water, and natural structure. The chewing process and intact fiber matrix slow digestion and moderate glucose absorption. When you drink orange juice, even freshly squeezed, the fiber is largely removed. What remains is concentrated sugar delivered rapidly to your bloodstream. That difference is massive. A single glass of orange juice can spike blood sugar far more aggressively than a whole orange. Whole oranges also contain flavonoids that may support vascular health, something particularly important for individuals managing diabetes. But again, portion size matters. 1 medium orange is typically reasonable. 3 or 4 in one sitting, that's a different metabolic scenario. You're probably noticing a consistent theme. It's not just the fruit, it's the form, it's the portion, it's the pairing. And when these factors are controlled, fruit does not have to be the enemy. Let's continue with 2 fruits that often surprise people when it comes to blood sugar control. 7. Avocado. Yes, avocado is technically a fruit, and metabolically it behaves very differently from most fruits on this list. Avocado is extremely low in sugar and high in healthy fats and fiber. In fact, its carbohydrate content is minimal compared to traditional sweet fruits. This makes avocado one of the safest fruit choices for individuals with type 2 diabetes or insulin resistance. Instead of causing a glucose spike, avocado can actually help stabilize blood sugar when eaten with other foods. The healthy monounsaturated fats slow gastric emptying, meaning carbohydrates from other foods are absorbed more gradually. This can significantly reduce post-meal glucose variability. Additionally, avocado is rich in potassium and antioxidants that support cardiovascular health, an essential consideration for people managing diabetes. Because let's remember, managing diabetes is not just about glucose, it's about protecting blood vessels, nerves, kidneys, and the heart. Avocado supports that broader picture. 8. Peaches. Peaches often get labeled as too sweet, but in moderate portions they can fit into a balanced plan. A medium peach contains fiber and a moderate amount of natural sugar, not excessive when portioned correctly. The key factor is density. Compared to dried fruit or tropical fruits like mango, peaches contain more water relative to sugar, which lowers overall glycemic load per serving. Water content matters. It dilutes sugar concentration and slows digestion. However, there's an important warning here. Canned peaches packed in syrup are not the same as fresh peaches. The syrup dramatically increases sugar load and glycemic impact. If choosing canned, they should be packed in water, and even then, portion awareness is critical. Fresh whole peaches in reasonable servings are far different metabolically from processed versions. At this point, you may notice something powerful. None of the fruits we've discussed so far require elimination. They require understanding. Now we're moving into the final 2 fruits on the best list, and then we'll address the 5 fruits that deserve caution. Let's finish our best fruits list with 2 more excellent options that are often misunderstood. 9. Plums. Plums are another fruit that deserve more attention in diabetes management discussions. They are relatively moderate in natural sugar compared to tropical fruits and contain fiber that helps slow digestion. But what makes plums particularly interesting is their polyphenol content. These plant compounds have been studied for their potential role in improving metabolic markers and reducing oxidative stress, something highly relevant for people with insulin resistance. Plums also tend to be self-limiting in portion size. Most people eat 1 or 2 at a time, not 5 or 6. That naturally helps control glycemic load. However, the same rule applies here. Fresh plums are very different from dried plums. Prunes, while containing fiber, are highly concentrated sources of sugar because the water has been removed. That concentration increases the glycemic load dramatically in a small serving. So again, whole, fresh, moderate portion, that's the formula. 10. Grapefruit. Grapefruit is often included in diabetes-friendly lists because of its relatively low glycemic index and high water content. It provides vitamin C and antioxidants while delivering a lower sugar load compared to many sweeter fruits. The bitterness of grapefruit may also help limit overeating, making portion control easier for many individuals. But there's something important to mention responsibly. Grapefruit can interact with certain medications, including some cholesterol-lowering drugs and cardiovascular medications. So if you are on prescription medication, always consult your healthcare provider before consuming grapefruit regularly. From a glucose perspective, however, moderate portions of whole grapefruit are generally well tolerated by many individuals with type 2 diabetes. And now we move to something crucial, the 5 fruits that require caution. These are not evil foods, but they are fruits that can spike blood sugar rapidly, especially if eaten in large portions or in processed forms. And some of them are marketed as extremely healthy. Let's uncover them next. Now let's talk about the 5 fruits that people with diabetes should approach carefully. Important, this is not about fear. It's about understanding glycemic load and portion density. 1. Bananas, especially very ripe. Bananas are convenient and nutritious, but they become more problematic as they ripen. As a banana turns yellow with brown spots, its starch converts into sugar that increases its glycemic impact. A small, slightly green banana may be tolerated by some individuals, but a large, very ripe banana can cause a significant blood sugar spike, especially if eaten alone. Portion and ripeness matter enormously here. 2. Mango. Mango is delicious and very high in natural sugar. Because it's easy to eat large amounts quickly, glycemic load can escalate fast. Even though mango contains vitamins and antioxidants, the sugar concentration per serving is high enough that it often produces noticeable glucose spikes. Small portions may fit occasionally, but large servings can be problematic. 3. Pineapple. Pineapple has a relatively high glycemic index compared to many fruits we discussed earlier. Its sugar absorbs quickly, particularly when eaten alone or as juice. And pineapple juice, that's essentially a rapid glucose delivery system. Fresh small portions might be manageable, but it requires caution. 4. Watermelon. Watermelon surprises many people. It has a high glycemic index, meaning it can raise blood sugar quickly. However, because it contains a lot of water, its glycemic load per small serving is moderate. The problem is portion control. Most people don't eat one small cup. They eat multiple large slices. That's where the spike happens. 5. Dried fruits. Raisins, dates, dried apricots. This is perhaps the most important category. When fruit is dried, water is removed and sugar becomes highly concentrated. A small handful of raisins contains the sugar equivalent of multiple grapes. Dates are extremely dense in sugar. Dried mango, even more concentrated. These foods can cause rapid and significant glucose elevations. Even though they are natural, they behave metabolically more like candy than fresh fruit. The lesson here is simple. Natural does not always mean blood sugar friendly. Understanding density, concentration, and portion size is essential. So what's the real takeaway here? Fruit is not the enemy of diabetes. Lack of strategy is. If you remove fruit entirely out of fear, you may miss out on fiber, antioxidants, micronutrients, and plant compounds that actually support long-term metabolic health. But if you eat fruit without understanding portion size, glycemic load, and pairing strategy, you may unintentionally spike your blood sugar repeatedly throughout the day. The difference is knowledge. Choose whole fruits. Prioritize high-fiber options. Control portions. Avoid juice. Be cautious with dried fruit. Pair fruit with protein or healthy fats. And most importantly, monitor your own response. Everyone's glucose tolerance is slightly different. If you have access to a glucose monitor, observe how your body reacts. That data is powerful. Managing type 2 diabetes is not about restriction. It's about intelligent decisions made consistently. And when you understand how different fruits affect your metabolism, you regain control instead of living in confusion. If this video helped clarify what to eat and what to avoid, make sure you subscribe for more evidence-based guidance on diabetes, insulin resistance, and metabolic health. In our next video, we'll talk about something just as controversial, natural sweeteners. Are they truly safe for diabetics? Or are some of them silently increasing insulin resistance? I'll see you there.